Um, Hi, everyone. I'm so humbled and I'm so honored to be with you tonight. Um, I feel now that I'm now part of the PWRDF family. I've been working with PWRDF now over the last almost four years. Um, Partners in Health has been partnering with PWRDF to support vulnerable communities in Rwanda and across the world. And as now I reflect on the work we've done, I wanted to first of all thank you so much, thank you everyone who is uh, supporting this wonderful work we're doing. Um, May God bless you all. Um, I Susan asked me to give some reflection on HIV/AIDS, and I, as I'm thinking, as I'm trying to reflect on this pandemic, I would say three words come in my mind. One is how could we stay in the house of yes? The house of yes is, for me, uh, how could we not always say it's not possible to bring treatment, to bring care to vulnerable people? Uh, Back in 2002, our founder, Dr. Paul Farmer, when he was in Haiti, he saw how people living with the HIV was just dying. And he also saw uh, how with the treatment, the ART treatment that was available at that time in US, he managed to bring some tablets actually to Haiti, and he saw how people, when they were taking those medication, their life and their health improved a lot. He he say, if we if I'm able to treat these people in Haiti, it's also possible for everyone across the world to benefit from the treatment and not just die from stupid death. He, for me, was in the house of yes. He say we shouldn't only deny treatment, available treatment to vulnerable people. At that time, the UN, many people were saying it's not possible to treat patients with HIV living in low resource settings. Paul Farmer was in the house of yes. Today, almost 2 decades after that, countries like Rwanda and others are now able to treat HIV. There's a universal access to antiretroviral treatment. I'll give an example. Um, Eswatini, which is a very tiny country in just near South Africa, with almost 1 million people, the HIV prevalence is about 27%. So meaning 27% of people living in Eswatini live with HIV. But together with uh, uh, global funds and other organizations and the government and communities, the country managed to reach the 395 targets. So 395 targets means 95% of people living with HIV, they know their status, their HIV status. 95% of the people who know their HIV status and who are HIV positive, now they have access to HIV antiretroviral treatment. And among those, 95% of the people who are on treatment, they have suppressed their viral load, meaning they can't transmit any more HIV. This is such a progress, this is a tremendous progress made in just 2 decades. People who believe, who are in the house of yes, they made this possible. It reminds us that we need to be in the house of yes. Today we are talking about HIV. There's also COVID, cancer. We know treatment is available somewhere. How could we be in the house of yes and make sure that we advocate, we support people living in a remote area in poor countries to have access to those treatments? Let's really pray for God to give strength to stay in the house of yes. The second is solidarity, of course, solidarity with patients living with HIV. How could we make sure that we don't discriminate them? How could we make sure that we support communities? We show them love and support in their needs. It's true that a lot of things have been made over the last 2 decades, but we know there are also a lot of challenges ahead of us. Today, we have a big number of adolescents living with HIV. And you can imagine the whole life for them, what the whole life for them is, and all the challenges they'll be facing for their future life. Let's really pray for them. Let's support communities. Let's support organizations who are working with adolescents, particularly adolescent girls, women, to continue supporting. I mean, make sure that they have whatever they need in terms of treatment, social support, counseling. So solidarity is, for me, this, as I reflect on this HIV/AIDS pandemic, solidarity come in my mind. The third is really about, humility. We always tend to say, those with HIV, maybe they did some sin, they commit some sin. We still have a lot of those narrative, those judgment, discrimination here. How could we make sure that we are humble to understand and put in their shoes and not discriminate them? So humility for me is really very important. Let me stop there, but I wanted really to thank everyone, to thank PWRDF, to bring us together, to reflect, to pray, joy in our hands, joy in our heart, for people living with HIV, but more broadly for people in suffering. to show solidarity, to pray for them. Thank you all. And thank you for having me on this wonderful moment.